Elixir. What is it? What does it do? How does it work? And what's all the buzz about? Hi, I'm Dr. Athré with Athré Facial Plastics in Houston, Texas. I'm a double board certified facial plastic surgeon. For complete transparency, I'm also a key opinion leader for Elixir MD. You've seen a lot of videos on my site. You've seen a lot of videos on my YouTube site. You've seen a lot of videos on my Instagram and other social media avenues about Elixir. What is Elixir? So Elixir is a photobiomodulation device. What does that mean? In plain and simple English, photobiomodulation, if we break the words down, photo, light, bio, life, modulation, to be able to change. So therefore, we're using light to affect change in living beings, or living items, or living chemicals, something to that effect. So what Elixir MD uses is high-intensity LED light. Now, most of you out there, if you're seeing this video or hearing about this, are probably pretty well versed with the red light therapies and yellow light therapies that's frequently used in the aesthetic industry. Same idea. We're using light in order to affect change. Now, the Elixir MD is an FDA-approved device, and what it actually does is several different things. There are several key modes to the Elixir MD device. The first key mode is the detox mode. This mode is used right before surgery. The light on it is almost a bluish light, and the patient lies down under this bluish light. And what it does is it affects change on the skin. It has a couple of different effects. Number one, it reduces the bacterial count. Number two, it also reduces some of the sebaceous activity of the sebaceous glands. So what is the end result of this? Number one, you have less bacteria on the skin just prior to surgery. Always a good thing, minimizes the chance of infection. Number two, the decreased sebaceous activity or sebum production from the sebaceous glands helps heal the skin a little bit quicker with less issues post-surgery. The next major mode of the Elixir MD device is the cellular repair mode. This is the mode that most patients are familiar with. I have my patients come in roughly about every other day to undergo a cellular repair treatment. Each treatment is about 15 to 20 minutes. As the patient lies underneath the light, there's a couple of things that's happening scientifically as well as from the personal level of the patient. From the scientific standpoint, you're helping myoepithelial cells contract, moving fluid around, thereby reducing bruising and swelling. From the personal, how the patient feels type of side of it, most patients say that they notice that their skin feels less tight, most of the tissues feel less tight, and they see a decrease in the swelling when using the Elixir MD. Finally, following the cellular repair, there is a Roxium treatment at the very end, and these treatments are really kind of a maintenance type therapy to maintain the tissue integrity for the patient. All of these things are documented by scientific studies by Elixir MD. Furthermore, I will tell you some personal standpoints with respect to Elixir MD. I was probably the biggest skeptic when Elixir MD first approached me and when I first found out about it. So I tried it out like any other scientific experiment. And I really found that number one, that bruising and swelling really did improve. The second major thing that I found out about the Elixir MD is that patients like it. So therefore, they feel better. They feel better quicker after surgery. So both of these factors, the scientific factor as well as the psychological factor, is very important in the healing aspect, especially after surgery. Finally, one of the things that by the way, side effect of Elixir MD, since patients were having to have these treatments every other day, they were coming into the office a bit more frequently. One of the advantages of this was that patients were able to ask questions at a more frequent level. Otherwise, what would happen is I would normally operate on a patient, see them the day after surgery, and then see them roughly about 5 to 6 days after surgery. However, with the Elixir MD, I was seeing the patient on the first day after surgery, the third day after surgery, and the fifth day after surgery, so on and so forth. By having that increased level of communication with the patient, patients got their questions answered more quickly. And I think that during that 3 to 5 day period where patients have a little bit of anxiety as their swelling goes up from a physiological response, that allowed them to come in and me to re-assuage them, to tell them that, hey, everything's okay. Overall, patients liked that better and they got better results. So long story short, Elixir MD is an LED-based device that really affects the cells and the tissues of surgical areas, in my case, the face, to minimize swelling, minimize bruising, and speed up the healing process, all while making the patient feel better quicker. All positives, if you ask me. So, if you decide to have surgery here at my office, one of the things that you will be offered is Elixir MD. It's something I believe in, and I think that patients are getting better results. I hope that this content has been useful to you and you learned a little something from it. If you found this content useful and you liked it, please give us the like or hit the subscribe button. If you have questions, comments, things like that, please let us know. It gives us some ideas for future content ideas. Finally, I'm Dr. Athré, Athré Facial Plastics, Houston, Texas. Thank you so much.